Dr. Laura Rossman. I am the health officer for Howard County Health Department. I'm here to greet you and welcome you. Thank you so much for coming to this event and coming to Howard County. It's always good to have a standing room only event, and we did that. I want to acknowledge elected officials who are here today. We have Delegate Tina Melnick from District 21.
Good morning.
We have Delegate Heather Bagno, District 33C. We have Senator Clarence Lamb, District 12. We also have the President and CEO of the CDC Foundation, Dr. Judith Monroe. And before I turn this over to your host, Boris Lishniak, I want to thank Macho for helping organize this meeting, and some of the Howard County Health Department staff who have helped set it up. So,
Great, thank you so much, Maura. My name is Boris Lishniak, and I happen to be one of the three co-chairs of this Commission on Public Health. Thank you all for gathering here today. I do want to also add to that list of people who are sitting at our front desk here, and that includes Dr. Meg Sullivan, who is the Deputy Secretary of Public Health, and she'll be speaking to us shortly, as well as Lauren Levy from the Harford County Health Officer, representing the Maryland Association of County Health Officers. So thank you. Thank you, and a shout out to Howard County Health Department for hosting us in this beautiful facility. And I always, approach these facilities, right? When we sort of, go in, the beauty of us in the DC area is what? Is parking, right? And so it's great that we have the parking out there. But then to walk into here and to see a building that's alive, right? Alive with people, right? Looking for services. Because ultimately what we're talking about here today, and the prelude to all this, is we are here for good. We are here for the public's good. We are here for the public's health. 2 years ago, I received a letter in the mail signed by the governor saying, you've been selected to be a commissioner, and then shortly thereafter, a co-chair of this commission. After 2 years of work, we finally, on October 1st, meeting the deadline here, elected personnel, I just want to say. And that report was issued. It was issued back to the governor, was issued to the legislature of Maryland, was issued to our partners with a list of recommendations. And here we're now beginning a process of dissemination of this information. So welcome to this next stage of the Commission's history. We would not be here without the support of elected officials. The elected officials voted on something over 2 years ago. It was legislation that created this commission. And that legislation led ultimately to an endpoint. And that endpoint is here. Everybody walk away with a copy today. Because this is not just a bunch of pages put together. This is something that we strongly, as public health people, believe in. This is something that just won't be put aside, we believe, but something that will, with time, be introduced to the good of our people of the state of Maryland. So I'd like to first introduce and have come up to the podium Delegate Jocelyn Pena-Melnick, who played a key role in this piece of legislation, and to share her words with us.
Thank
you so much for being here.
So good afternoon, everyone. Can you hear me? Yes. It is an honor to be here as we release the final report of the Maryland Commission on Public Health. This is really impressive work. I want to thank Dr. Lishniak, Dr. Brewster, Dr. Olateyu, the commissioners, the work groups, and every partner who poured time, expertise, and their heart into this effort. Because that's what it takes. Because you didn't have funding, right, at the beginning at all. And you went out and got your own funding. And we contributed very little funding to it, and that is really the truth. But you went on and you did the work. And your work is a true service to the people of Maryland. I want to thank my colleague, my amazing sister from another mister, Dr. Bagnall, who chairs the subcommittee on public health. And she's the person that I give a lot of difficult things that I don't want to do. And she does it with grace. And my amazing colleague, Senator Lamb, who actually introduces many of the bills that I introduce and other people, because it takes two chambers. One alone cannot do it. And I see the Department of Health and many other people here that I love and respect, and I want to thank you for the work you do. This moment is deeply meaningful to me. I have served on the Health and Government Operations Committee since my first day in the legislature, which was in 2007. And I want you to have a little perspective on who I am. I came to this country as an immigrant, 8 years old, with my mom who was a single parent, and we lived in New York City. And I learned early on the needs. We were on Medicaid. We were on welfare for a while. She learned to sew, and she worked in the garment industry. My sister and I stayed home, and we didn't have oftentimes someone to take care of us. We didn't have a place to live. Also, at the beginning when we came here, we stayed with relatives and friends. And I know what it's like not to have a meal. Growing up in the Dominican Republic, we grew up in a little house at one time where there were 17 of us, where the bathroom was a latrine in the back of the house, a hole, where my toilet paper was dry corn husk and newspaper, where I had to walk to school and come back more than an hour in the sun. So you see, no one can tell me about those social determinants of health, because I lived it, I experienced it, and I experienced it with my mother as well. So when I decided to run for office, I'm the first in my family to go to college and go to law school and run to office. That was, unheard of. I did it because I care in a very humble way. And I asked to be on that committee, and I haven't moved since, because I think that it is important to have lived experience. So nearly 20 years of working alongside Maryland's public health system has shown me its strength, its struggles, and the tremendous weight it carries. I have seen dedicated people doing critical work with limited tools all the time. Public health is usually an afterthought, right? Outdated technology, short staffing, and systems that don't always speak to one another. When public health is working well, it is often invisible. No one talks about it. But when something breaks, the impact is immediate and undeniable. And that is exactly what COVID revealed. Our public health workers gave us everything they had. Local health departments like you showed up in every community every single day. But they were asked often to fight a fire with outdated equipment. Technology lacked, communication systems were strained, and the workforce was exhausted. We were responding in real time to a crisis that we should have been better prepared for. The pandemic reminded us that public health is not just programs or policies. It is clean water, safe food, disease prevention, maternal and child health, emergency response, and the protection of our most vulnerable neighbors. When public health is strong, people live longer and safer lives. When it's weak, the price is paid by families and communities. That is why the bill creating this commission matters so much to me. That is why I introduced it, and I met with a lot of experts to see how can we frame it, how can we draft it. We needed more than temporary fixes, which is what we always do. We put a temporary band-aid, and then it gets more expensive. We needed a full and honest look at our system, because I learned that it was broken and that there was no consistency and that we were operating in silos. And I wanted to change that. So this report that you did offers a clear roadmap for stronger leadership, a modern workforce, better data and technology, improved communication, and true collaboration between hospitals, school, businesses, and government, which is so important. Only one other state in the country has taken on a review on this scale, but Maryland is the only one where the legislature led, all right? So that speaks to the commitment, not just to study the problem, but to understand it, honor the work behind it, and to take it seriously. As a chair of the Health and Government Operations Committee, I am committed to do that. And what I would like to do, and I did not talk to you about it, is that I'd like us to form a small work group, all right? And I hate to ask you to do more work, so that we can meet with the Department of Health, right, and with Mitchell, to see what can we do this coming session. Because you see, I don't want this to be put on the shelf, all right? I want to see what are those, realizing the challenges that we have with our budget. And I must say, right here, and I speak for my colleagues, that those challenges are not because we caused them. Okay, the challenges that we have right now, especially with the budget, are caused by that big, awful bill. And because we're so close to the federal government, and we have so many federal workers, and we have so many waivers, and we depend on the federal government, okay? Let's be clear where it came from. But I believe that we can look and see where there are low-hanging fruits that we can work on. And that is what I propose to you. And I don't say what I don't mean. So I would like you to email Michelle Furman, who's out this week because I made her take a vacation finally. And I'd like you to, she'll answer next week, ask for a meeting. I'd like to create a small work group. And I'd like you to think who should be the people involved besides the obvious that I just stated. And let's see what we can take from here. And let's do it one session at a time. Okay? And I'm committed to that. Thank you so much for having me. And thank you for having a beautiful part where you have empathy and you care, which is what's needed during these very difficult times. Thank you so much.
Thank you so much. Thank you, Melnick. We also were honored that we had two other representatives of our state legislature who were actually commissioners alongside of us. And these will be our next two speakers. At this time also, I'd like to acknowledge the fact, and you can all raise your hands, is members who are commissioners present in the room. Raise your hands, commissioners, ex officios, everybody working group members, leaders of working groups, our assessment team, raise your hands as well. Now I'd like to introduce Delegate Heather Bagnall, who was a key member of our group of commissioners, and share with us your wisdom. Thank you.
First of all, thank you. And I really reiterate the thanks of my amazing chair and my mentor and my friend. And I acknowledge that it is very hard to go after her because she speaks all of our hearts. This has been quite a journey. This report, it's a novel start to improving Maryland's public health outcomes post-pandemic, and it creates a framework which other states can emulate and which will continue to inform our state for years to come. It's exciting to see public health having a moment, having a really meaningful moment right now, because it is so meaningful for every community. And this work will help not only guide our work in the future, but it's going to help raise the public consciousness of the essential role public health plays in the physical and mental well-being of Marylanders, and also in the overall well-being of our state. For over 2 years, the dozens of experts have met consistently to ensure our state has a clear vision to improve health outcomes and ensure consistency in care for all Marylanders in a way that is thoughtful, impactful, compassionate, and based in real health data and real world experience. And for that, I am incredibly proud of the work that we have accomplished so far, and I'm immensely humbled to have been a part of that work. I also want to thank my chair and our speaker for the opportunity to be a part of this work, because being in a room full of experts, doing the hard work all the time, it really speaks to the commitment that Maryland has to ensure that every Marylander has access to quality health care. And today marks the end of one journey, but it also marks the true start of the work ahead. This isn't just a report, this is a lifeline. These recommendations will have a real impact on Marylanders and the future of health in our state, and we will have to not only change laws and regulations and systems of health, but also our way of thinking, and even our belief in what is possible to match the vision in this final report. And the fact that we have done this deliberative work, and to my colleague's point that we're not just going to put this on a drawer, this isn't going on a shelf. It demonstrates our commitment, our shared values, and our belief in public health as a priority. In a time when expertise and trust and investment in public health may feel in short supply, this report demonstrates that that's simply not true. That expertise, that trust, that investment of your time and knowledge and sweat equity is right here in this report. In this room, we have dozens of professionals representing hundreds of clinical hours. In this report, we have decades of institutional knowledge serving Maryland, and we have documented not only a vision for our future, but we've memorialized the work and the expertise, the knowledge and the process of achieving that vision. We have a lot of experts and a lot of voices who can provide their expertise to us, the decision makers, when we bring this forward to the legislature. As we are looking at what we can do now, what we can do in the future, and new ways of doing it. But today we demonstrate that Maryland continues to be a state that relies on our experts to help us make decisions for the good of our population, and that we believe that investing in the well-being of our communities is a sound investment and a worthwhile effort. And through our continued advocacy and input and engaging our communities, we will see real progress on implementing these recommendations and building a public health system that not only meets the needs of our communities, but meets this moment. As we stand at the crossroads in a national debate on healthcare, Maryland continues to lead the way in advancing public health. And I am just so truly humbled by this moment and by our shared commitment to making sure that we make this vision a reality.
Thank you so much, Delegate Agnew. Another critical member of our team of commissioners is Senator Clarence Lamb, who not only brought in, obviously, a representation of the Senate of the state of Maryland, but also as a fellow physician, preventive medicine faculty member, brought in that approach of understanding the needs of the citizens of Maryland from that medical and that public health perspective. So, Senator Lamb, thank you.
All right, good afternoon, everyone. and it's a pleasure to be here to see the culmination of a tremendous amount of effort and work that went into this report today. And really pleased to be here, and also want to commend my colleagues. There is not a major piece of healthcare legislation that passes through the General Assembly that doesn't have the fingerprints and the strong leadership and effort that Chair Pena-Melnick has to be able to make sure that that piece of legislation, particularly health legislation, supports everyone across the state in an equitable and supportive fashion. So thank you. She was there when we first worked on this legislation several years ago. This was back in 2023, when then Delegate Ariana Kelly was the sponsor on the House side, and I was the sponsor of the Senate bill of HB 214 that ultimately passed in the 2023 session. That was the inception point, and that was through a lot of vision and leadership from Chair Pena-Melnick, from the Public Health Subcommittee Chair, Delegate Bagnall, and so many of us that really identified the need to be able to step up and support this. And just wanted to set the stage for where we were. If you remember, kind of rewinding the clock back to 2023. This was basically the year after the pandemic, right? And it was certainly a challenging time. This audience in this room certainly recognizes and understands that. It was a time when our local health departments were exhausted. We had many local health officers, almost probably half of them had gone on to do different things for a variety of reasons. We had a state health department that in many ways, at least from our perspective, was in a bit of a disarray. There were a lot of reliance on contractors. There were management challenges that were going through. And we had local health departments that were stretched to the max. When you look back at that time, and even through now, the public was tired. The public was tired of public health. You had a bunch of armchair epidemiologists sitting at home watching TV. You had a public who did not want to hear about public health anymore. And when they heard about public health, their initial gut reaction was, you're going to tell me to mask, and you're going to make me do something I don't want to do with some mandate. And so, but we recognize when it comes to public health that we can't let any crisis go on without using that as an opportunity, and an opportunity for good, and an opportunity for change. And it's not easy, because here in Maryland, we have a semi-centralized structure to our state and local health department system. Every state is different. Local health departments are different. There's an old saying that when you see one local health department, you see just one local health department. And that means that we needed to be able to kind of take it all in, bring in a lot of experts. And we're also fortunate to be a very resource-rich environment, where we have large world-class public health institutions like Johns Hopkins, like University of Maryland, and a very strong University System of Maryland system to bring in folks from Coppin and from Morgan to also ensure that we have diversity in our perspectives. And we're fortunate to have a very hardworking and dedicated public health workforce here who does such a tremendous variety of things, everything from outbreak investigations to well and septic inspections to analyzing cancer clusters, to even animal control and even noise violations. The breadth that our local health departments work through is absolutely tremendous. But through that expertise, we wanted to bring in a whole bunch of stakeholders. We'll recall back to when the legislation was being passed, everyone wanted to see the table, right? Because they recognize how important this is. That's why we have 3 co-chairs. And I want to credit our 3 co-chairs for this, because it really required a team effort, why we brought 3 of them in. Usually we have 2, and you stop there. But we have 3 because we recognize the tremendous lift and the effort that was needed. So thank you, Dr. Brewster. Thank you, Dr. Olateju, and Dr. Lushniak as well. We could not have done this without your leadership. And as Chair Pena-Melnick mentioned, when public health works, it's oftentimes invisible. But we know in this room how critical state and local health departments are. That you are the arms and ears, the eyes and legs of public health in our local communities. That while we appreciate everything that CDC does, and they do important work, and thank you, Dr. Monroe, for the support of the foundation, that a lot of the funding is provided to local health departments. That while CDC may establish the national guidelines, the work that's happening on the ground is oftentimes happening at our state and local health departments. that while CDC's collecting the data, you are the ones trying to move the data to have better health outcomes that we'll be able to see at the national level. And so where the rubber hits the road is right here at our state and local health departments. And unfortunately, public health only becomes visible when there's a crisis or when it affects you individually. But that's why we needed to take an effort to step back for a moment, to take a holistic approach and view and observe and understand where our public health system is here in the state of Maryland, and also what we can do to help improve it. And this commission was very methodical, rigorous, slow, but slow in a good way, in its process, to be very thoughtful in its recommendations. They held interviews, focus groups, did assessments, did surveys, had expert presentations from public health professionals from across the state to come in. There were 5 work groups that were set up. We debated wording. We had voting on our phones through surveys. We even extended the time of the commission because of the breadth of the work that was being done here. And so we want to commend the commission partners and the leadership that's been provided by the State Health Department, by Maryland Department of Health, and I know we have some of our colleagues here, by folks like Dr. Monroe and the CDC Foundation, partners like the Beaumont Foundation, and also Bloomberg Philanthropies, and also some of our commissioners, all of our commissioners. I know some of whom are in this room, who put a tremendous amount of time and effort and talent and expertise to be able to come up and craft these really unique recommendations. They traveled throughout the state, they came on Zooms, they participated in so many different meetings to be able to make this happen. And we want to thank them for all the work that they've done. And they should know that the legacy of this commission continues. Not only are we going to start a work group, because Chair Pengamelic said we will, and with that directive, we will. But the commission has given a tremendous charge to the General Assembly, to those of us there, to the State Health Department, to local health departments, and partners and stakeholders to not just read this report, but to pick up the recommendations and run with it. And that we have to act. We have to be part of the change that's needed. From the legislature, you can be sure that Chair Pengamelic and Delegate Bagnall and I will continue to be champions and be outspoken advocates for all of your work. Please do not be a stranger, because we want to continue to hear from you. We're going to uplift this report and highlight it to our colleagues, but we still need the support from around the state to be able to continue this important work, because we know that public health is a team sport. All of you in this room are public health professionals, know that we can't do any of the work that we do on our own. Where would we be doing clinical medicine? But in public health, we have to bring everyone together. And so we need to continue to hear from you, the stakeholders in Annapolis, to emphasize why this is so important and why this work needs to continue to be done. This is a living document. It will adapt and change to the times and the environment, but also requires all of us in this room to continue to be champions of this work. And so, as I close, let me just kind of bring us back to the top here, right? When we started this work as the Public Health Commission, it was a very different time. It was a very different time. And we've had to kind of adapt to the environment as the Commission's work has progressed. But we're in a time now when public health appears to be under attack. Not the result of a natural phenomenon like a mutating virus, but an attack on public health that's occurring from within. It's a self-inflicted harm from leadership that disregards science, best practices, and empathy, and instead relies on niche interests, pseudoscience, disorganization, and even intentional disruption that's leading to the systematic dismantling of public health infrastructure, institutions, sound practices, accepted norms, and public faith in science across the nation. That, I think, is a national travesty. And while we can't control what happens at the national level, we can and we certainly will do what we can at the state level. The state of Maryland will not stand idly by in the aftermath of COVID and the dismantling of our federal public health institutions. Because as I've said from the top, from disaster and chaos emerge opportunity. And what this report affords us is the roadmap for an opportunity that we have, that we can control, to build a world-class public health system, one that will be the model of progress, collaboration, innovation, and initiative for the rest of the nation. So thank you again for all of the work of the commission. Thank you to our co-chairs, all the sponsors and support, stakeholders, all of you for being here. Our work is not yet done. In public health, we continue to the next phase. We're going to start that work group, and we're going to get some of this passed in the General Assembly session this coming week. Thank you so much.
Great, thank you so much, Senator. And as you mentioned, that it's going to take a team. We sometimes use that term, it takes a village to do something. And the village is here. The village was within the commission, it was within the working groups, it was within the state health department, it is within the local health departments of our glorious state. It is within multiple partnerships that exist out there. And one of our lucky breaks when all this started, and the chair was right? We were agog and aghast at the beginning because the work of this commission came with no initial funding. And yet we have to then rally. We found people who belong in that village, people who are passionate about public health, and our next speaker is a representative of that incredible village, and Dr. Judith Monroe, the president and CEO of the CDC Foundation. I'll ask her to come up, and I'll also ask the two delegates to come up as well, because we have a little surprise for you from the House of Delegates. And we have one for you, and one for Shane Hatchett, who's out there, and we'll have at least the primary words shared with you from the House of Delegates from our, yes, that is correct. Yeah.
So this reads,
Yeah.
Maryland House of Delegates, House Resolution, it says, be it hereby known to all that the House of Delegates of Maryland offers its sincerest congratulations to Dr. Judy Monroe and the CDC Foundation in recognition of your outstanding leadership supporting the well-being of all Marylanders through the Commission on Public Health. The entire membership extends its best wishes on this memorable occasion and is signed by Adrian Jones, Speaker of the House. Thank you very much.
Program manager and played a key role.
So I know that Shane is watching, so this says, House Resolution, be it hereby known to all that the House of Delegates of Maryland offers its sincerest congratulations to Shane Hatchett in recognition of your service as Senior Advisor and Manager of the Maryland Commission on Public Health. The entire membership extends best wishes on this memorable occasion and directs this resolution to be presented on this 13th day of November 2025. And once again, it is signed by Speaker Adrian Jones.
Great. Dr. Monroe, if you would.
Okay, well, I might be a little speechless. This isn't quite what I expected. So thank you so much. I flew in this morning from Atlanta, and as I was flying in, beautiful blue skies, and I couldn't help but just look out and see what a beautiful state that Maryland is. But what a treasure. What a treasure. You've heard today, and I know all the work, but to have legislators such as yourselves with the passion and the drive to move forward with public health at a time when we're coming out of a pandemic, I mean, an absolute treasure for the state of Maryland. And the leadership from your co-chairs and from all the work groups. I mean, I had a chance to follow along in my role at the CDC Foundation as we helped assist you. In some ways, some of you might ride an electric bike from time to time. We're a little bit like that boost. And the CDC Foundation kind of gives you the boost when you want to, you need some help. But the real work is in this room and across the state. But thank you so much. One of the things I need to mention is this is a little bit like coming home for me. Howard, thank you to Howard County Health Department. I actually lived in Howard County when I attended the University of Maryland Medical School. So I am a Maryland, I'm a product of the University of Maryland Medical School. So, it's really meaningful to me to be able to join you all today. And it's been an honor for the CDC Foundation. Some people may not know the CDC Foundation, but we are a nonprofit that's been operating now for 30-plus years, and we are here to support public health in whatever way is needed, and that morphs and changes in any given moment. So it's been such an honor, and it's been so great to watch you all examine, take a deep dive and examine what's happening in Maryland in public health, both the strengths, looking at the strengths, looking at the opportunities, and looking at what the future holds. We see at the CDC Foundation firsthand what's happening across the country, and that's a real privilege for us to have this bird's eye view. We get called by many states. We work in all 50 states, territories. We've done a lot of global work over the years, and we are at this pivotal moment. It's been referenced. It's a pivotal moment for public health in our country, and we need beacons like Maryland. You all are shining a light for the nation. All the states are trying to figure out where public health is going and what they need to do. So you all are really an example for the country, and it's so comprehensive. I mean, what a talk about a treasure. I mean, you all are going to have for years to come the publication of this final report and a blueprint. And the blueprint is so critical. Years ago, I remember hearing a story about what's the most important part of an ox cart. And people will say the ox, and some will say the cart, the wheels, and the answer is actually the blueprint. That somebody had to envision it, you have to have a blueprint. But then you've got to operationalize, right? Now the hard work does happen, but you can't build it if you don't have a blueprint. And so you all now have that. Another thing I would share with you as you now operationalize, I learned when I became a new state health officer, I was state health officer in Indiana for a few years before I went on to CDC and the foundation. And I learned something, it's called the strategic triangle. It's a way to think about progress in government. And the 3 points of the triangle are, first and foremost, creating public value. So that's what you all are really at the heart of this, is creating public value. And when you think about health, I just heard in a summit last week, 50%, it's estimated that 50% of economic growth over centuries has been because of health and public health. We can't have economic vitality without our health. So you all are creating public value with this blueprint. But then you need another point on the triangle is legitimacy and support, and having the support of your legislators, having resources that get mobilized. Right, there has to be that, but you can't create that without strong communications. Right, and that goes back to the creating public value. If you're not telling people what you've done, and that's Achilles heel of public health, right? All these things are prevented. That's the Achilles heel. But you all address communications in the report. And then the third point of the triangle is operational capacity. That you've got to be able to operationalize. But the thing about the triangle is they've got to work together. And if they're working, if one is strong, it feeds the other. But if you cut off any one of those 3 points, you're not going to be successful. So I share that with you because I've used that triangle nearly every day in my work ever since I've learned that. It's so exciting to see Maryland take this leadership role. The fact that you all have worked, at building on success. I mean, Maryland's a successful state with data systems, and we've done that. We've always been a state committed to community engagement. So you've really built on this legacy. You've tackled tough questions about governance funding, workforce sustainability, but you're also a future looking, and that's when you look at the data and the IT recommendations, and then particularly communications, because that's so essential in today's world. So it's super exciting. But again, I just want to emphasize the importance of this work is not just local and at the state level, but it's national. And it's national in a critical moment. And like I say, I get a chance to see that every day. So I'm super excited to see these strong, flexible public health system recommendations come out from the work that all of you have done. We'll continue to, for the part of the CDC Foundation, we'll be promoting this work, and we'll be letting others know. We'll be using your all's blueprint to help other states as they're coming and asking how they should approach their work. And I hope they have champions like yourselves. Again, I can't emphasize the support from the legislators, how important this is. It's also really important to have the support of the state health department. at the state level. That's critical in any system. That strategic triangle is going to work best when the system is working together, and that's from hyper-local up to the highest levels of state government. And let's be reminded, public health authority lies at the state level in our country. So essential that states are taking this type of deliberate work. So I just want to say, I mean, we've just been incredibly proud of the CDC Foundation to support all of you throughout the work. My young staff, we were talking earlier about I've got young staff at the foundation that have learned a ton working with you all. And so thank you for that. And again, just congratulations to all of you across Maryland that have put the effort into this. And I look forward to seeing what y'all produce, starting with the next legislative session. Thank you.
It takes a village, right? And part of that village includes the two individuals who just joined me here. Dr. Olutosin Olateju has played a critical role as one of the co-chairs, as has Dr. Menachie Brewster. With us came a variety of staff members as well. Staff members from St. Mary's County, staff members from Coppin State and Morgan State, staff members from the University of Maryland. Thank you for coming along. And this partnership, state, local health departments, the Beaumont Foundation, Johns Hopkins, there was so much there, and you're absolutely correct. You mentioned the team, you mentioned the idea that this is multifaceted. We also want a recognition that Nina wanted to give you guys.
Well, that must be all of us.
Yeah.
It's been a tremendous opportunity, a tremendous honor, and we are all just so very, very grateful to you, Dr. Monroe, and your entire team at the CDC Foundation. You carry forward Maryland in ways that you're just so meaningful to us. Thank you.
Thank you. Oh my.
Great. And now the co-chair will discuss a little bit about both the process as well as the results of the commission.
Thank you, Rose. Good afternoon again, everyone. Thank you so much. First, I want to echo the words of gratitude expressed by my fellow commission co-chairs, to our legislators, commissioners, work group members, the CDC Foundation, all the universities involved, and other partners that were involved in this process. My name is Dr. Oluwatosin Olateju, co-chair of the Maryland Commission on Public Health and HBC representative. It's an honor to share a brief overview of how we did our work, the process behind this landmark effort that helped and will help to strengthen and modernize public health in Maryland. So when the General Assembly and Governor Westmore established a 16-member commission back in 2023, which we heard about, our charge was simple, but it was one that we knew it was ambitious. To assess Maryland's public health system, both state and local, and give recommendations on how to make it stronger, more equitable, and more effective. The Commission's authorizing legislation also included the public health accreditations, which is five foundational public health areas and capabilities, as a guide to inform our work and as a basis for making our recommendations. We knew this had to be more than a report. It had to be a collective reflection of Maryland's communities, the workforce, and partners. And despite its rigor, we were very intentional about making the process inclusive and transparent, and which is the essence of public health anyways. Despite limited resources, we approached this task with one guiding principle. We had to listen widely, learn deeply, and lead transparently. The commissioners include 3 local health officers, individuals with experience in public health systems that are practicing in state academic institutions, including HCU, persons with expertise in the workforce, population health, IT, health equity, and representative from the Senate and another from the House. We also had ex officios from MDH, including the Deputy Secretary for Public Health, Deputy Secretary for Behavioral Health, and the Director of Office of Minority Health and Health Studies.
Now, talking about travel, we really went, far and wide. In 2024, February 2024, we traveled to Indiana to meet with Indiana Commission members, serving as a role model since they actively engaged in a similar work between 2021 and 2023. To carry out our charge, we used a systematic, multi-layered approach that blended data and community voices. Our process started with anchoring our work by developing a conceptual model grounded in evidence-based public health. That framework guided every step, from assessing community needs to evaluating data and shaping recommendations. It kept us focused on both the science part and the people that we serve. Next, we created an assessment framework and used multiple tools to understand Maryland's system from every angle. The process included creating surveys that were deployed, both organizational survey, which was deployed to health department, and an individual staff survey to capture perspectives on the structure, workforce, and capacity. We also utilized key informant interviews of local officers, deputy health officers, and leaders from key stakeholder organizations. We also conducted focus group and public listening sessions across the state, going from Western Maryland to Central Maryland, Southern Maryland, and on the Eastern Shore, to hear directly from staff, community members, and residents. Those sessions gave the public and our workforce a real voice in the process. We did site visits of 5 local departments, seeing firsthand the challenges and innovations on the ground. And finally, public comments. We opened a public comment portal and invited written and recorded submissions. Every comment was read, grouped under themes, and considered. In fact, we had over 30 substantive submissions, which helped to shape our recommendations that we're presenting today. Over 2 years, the Commission held 26 hybrid public meetings since its first meeting in December 2023. Each was open, again, like I said, and the commissioners, the 3 commissioner co-chairs, we met at least once every week. We also arranged guest speakers at commission meetings, and these speakers helped to further guide the discussions and topics that highlighted in the study. We walked through 5 expert work groups that encompassed over 100 members and were led by work group co-chairs, 20 work group co-chairs. All of these focused on workforce, data and IT, governance and organizational capabilities, communications and public engagement, and funding, which we are aware of how critical it is. The Commission also integrated the legislation's 6th focus area, which is procurement. All of these are essential building blocks for a strong public health system. Our academic partners who are represented here in the room today, University of Maryland School of Public Health, thank you so much for taking the lead and also working with academic partners such as Morgan State University, Coppin State University, all playing a role, a vital role, in the design, conducting, and analyzing of our comprehensive statewide assessment. They also helped to provide interns who served as support staff across the work groups and helped with commission leadership efforts. Another crucial partner is Johns Hopkins School of Public Health. They assisted in providing staff support. Additionally, the Dave Beaumont Foundation helped on the focus group with local health officers on the topic of workforce, which is crucial. And we are very proud to say that that focus group, the workforce from the Dave Beaumont Foundation, included 100% of local health departments in Maryland. That's something to be very proud of.
Yes.
Also, the Commission received support from philanthropic organizations through partnerships with the CDC Foundation as they helped with dedicated staffing support. Now, throughout this process, we stayed very true to our 4 values, which are our core values, as those values guided our decision. Those values are communication, equity, inclusion, and innovation.
Those values not just shaped what we studied, but how we listened and how we planned to act in the future. This has been an open, evidence-based, community-informed process, one that reflects thousands of voices across Maryland. Together, we've created a roadmap that will help move Maryland's public health system from reactive to proactive, from fragmented to coordinated, and from good to truly great. And now, it's my pleasure to introduce my fellow co-chair, Dr. Mina Brewster, who will walk us through what we found and the key 5 themes that will shape the future of public health in Maryland. Thank you.
Wonderful. Good afternoon, everyone. Thank you so much for being here. And thank you to Dr. Olateji for describing the comprehensive process this commission has gone through in the past 2 years. Our final report makes one message very clear. A stronger, more modern, more connected public health system is within our reach, if we choose it. My hope is that we will use these 5 themes that the Commission has prepared to guide us in that choice. First, we must strengthen our foundation. Public health is essential infrastructure with the most important return on investment, life itself. Maryland needs expanded, stable funding, clear roles between state and local public health entities, and a better human resources system supporting the workforce that we ask to save lives every day. Second, we must modernize. Our residents deserve real-time data, strong communication tools, and interoperable technology that allows us to act quickly and transparently. We can't protect tomorrow with yesterday's systems. Third, we must build deeper relationships and partnerships. Communities thrive when public health links arms across sectors, and when we include the diverse voices of the community members that we serve. When we're together, we're stronger and are ready for any challenge ahead of us. Fourth, we must bridge public health and healthcare services. Marylanders experience their lives in one continuous way. Similarly, prevention, clinical care, behavioral health, preventive services, and community services must work as seamlessly as the people we serve. And fifth, we must invest in our future leaders. Our public health workforce is our greatest asset, and our public health leaders can't run on empty. Developing talent, growing diversity, tending to the well-being and safety of our workforce, and opening leadership pathways are how we secure a healthier future for today's residents and tomorrow's future. This report is more than a set of recommendations. It's a call to build a public health system worthy of Maryland's people. Strong, innovative, equitable, and ready for whatever comes next. So thank you to the Commission team, public health professionals, and every expert and community member who shared their voice during this process. We are very, very grateful to all of you. Your commitment is what brought us to this moment. Thank you.
Thank you, dear co-chairs. It takes a village, and part of that village includes the State Health Department. I'd like to introduce Dr. Meg Sullivan, the Deputy Secretary of Public Health Services and co-chair, or a chair of the commission. Meg.
Thank you so much. I will just echo what Delegate Bagnall said about following Chair Payne Gamelnick and then having to follow the rest. I'm certainly going to be very brief. I first just want to commend these 2 co-chairs who've managed to sum up the process and then recommendations of a very thick book, which is very much heavier than I've printed, so succinctly yet so powerfully, and if anyone leaves here not inspired and excited by this work, then you know. So thank you, thank you, thank you. Thank you, Dr. Monroe, for your work. Thank you, Dr. Levy, and of course, a shout out to all the local health officers and others here in the room. We know so much of the work happens at the local level. So, as said, my name is Dr. Meg Sullivan. I'm the Secretary for Public Health Services. And on behalf of Secretary Seshamani and the entire Maryland Department of Health, I really want to extend an appreciation to all of the commission members, their dedication and efforts on the assessment of our public health systems, foundational capabilities, and recommendations for what is needed to be continued improvement. I think we particularly appreciate the thoughtful feedback and public engagement efforts and share the Commission's prioritization of community-driven engagement. As a pediatrician who spent a good part of my career at the local level, including local public health, I know so well how much that work happens, where that work happens, how important community engagement is, and that is what guides our work that we do at Maryland Department of Health every day, and will guide our work as we move forward with these Commission's recommendations. I'm proud to say that at MDH, we've already made progress in several areas that are very aligned with Commission's recommendations. Just as a few examples, we have prioritized building strong partnerships and improving communication and information sharing. For example, collaborations with local health officers who we know are critical leaders in their communities and across Maryland. We spent significant work over the past 3 years to develop consumer-facing interactive dashboards to offer actionable information across a variety of public health focus areas, and have been working so hard on data modernization, including updating the PHS, Public Health Services Data Modernization Strategy, to focus on key priorities in the current public health landscape. We know that we need to continue to prioritize this work in the coming year, as resources and scope allow, with a mindfulness of the broad fiscal challenges and uncertainties public health is facing nationally right now. And we look forward to working with our elected, with our locals, with all of our commissions, to continuing to partner with you on this critical work. Thank you.
It takes a village. And now to close this program, part of that village are the local health departments as well. I'd like to introduce Ms. Lauren Levy, Harford County Health Officer and Vice President of the Maryland Association of County Health Officers, MAJO, which I also send a thank you because MAJO provided refreshments here today.
Good afternoon, everyone. Thank you all for being here. As Dr. Lushniak said, my name is Lauren Levy. I have the pleasure of serving as the Health Officer for Harford County, as well as the Vice President of the Maryland Association of County Health Officers. I'm honored to speak today on behalf of Maryland's 24 local health departments as we celebrate the work of the Commission on Public Health. This report represents a defining moment for public health in Maryland. The Commission has laid out a thoughtful, forward-looking roadmap for strengthening our public health system, one that places strong, well-supported local health departments at the very foundation of a healthier Maryland. Over the past several years, Maryland's local health departments have faced unprecedented challenges, from the COVID-19 pandemic to addressing behavioral health challenges and overdose in communities, to addressing chronic diseases and environmental health risks. Through it all, our workforce, dedicated public health professionals, have shown resilience, innovation, and a deep commitment to the communities we serve. The Commission's recommendations affirm what we in local public health have long known. A healthy Maryland depends on strong local capacity. Our local health departments are the boots on the ground, responding to emergencies, delivering preventive services, and building trusted partnerships with residents, healthcare providers, government agencies, community organizations, and so many more. We are especially encouraged that the Commission emphasizes the need for sustained, flexible funding, a stable, well-trained workforce, and a coordinated system that allows state and local partners to work together seamlessly. These are the pillars of a modern, effective public health system, and NACHO is fully committed to achieve our shared vision of a Maryland where every person has the opportunity to thrive. Thank you.
Great, thank you so much. So we're ready to adjourn, but allow me to say a few words in closing. First of all, this is not an option. For us to work for the health of the people of the state of Maryland, as an example for the nation, it's not an option. The tie-in is quite direct. Health is not an option, public health is not an option, and it ties in directly to the economic health of our state. It ties in directly to prosperity. It ties in directly to families, communities, individuals working together for the good of society. Last night we had an event at the University of Maryland School of Public Health. It was the annual convocation. And I want to share with you this image because last night I had 150, 200 of our students gathered together. In these difficult times, the students are sniffing out that things are not as stable as perhaps they used to be. And yet after a few hours spent discussing the service component of what they're being trained for, service at the federal level, service at the state, at the local level, there was a marked change of attitude. It was palpable in the room. And part of it was discussing the truth of our situation, but also walking away with that sense of optimism and the sense that public health has always been resilient. It's not an option. Our work can't just be put aside. On behalf of the Commission, I thank you all for being here. Delka Penyamela is married to a Ukrainian. I'm a Ukrainian American. And I'm going to close, much like I closed our last meeting, with a saying in Ukrainian. And the saying says, Закінчилися слова, починаються діла. The words are done. The actions begin. Thank you so much for being here.